Good day, everyone. So our topic is related to how the Department of Health takes place when it comes to the health informatics and nursing informatics in a national level. Our learning objectives for this afternoon is to distinguish the existence of the knowledge management and information technology system of the country, and on how this Department of Health agency will take part on its role when it comes to the implementation of the information technology, health informatics, and nursing informatics that will be implemented across the primary healthcare facilities up to the specialty care facilities. So as what I have mentioned, the topic for this afternoon is about the knowledge management and information technology system. And this is actually a department under under the Department of Health. Let us have an introduction pertaining to what knowledge management is and what knowledge management system is. When we talk about the knowledge management, it is all about how we use basic information that will translate this information to a process and will be useful for a certain system. Because just like, for example, we have the healthcare delivery system, basic information is very relevant when it comes to the implementation of certain processes. And the information coming from one area to another area, from one facility to another facility, will be very useful when it comes to clinical decision making. So that is knowledge management, when the one information may benefit other healthcare facilities, as well as where they're with their healthcare manpower when it comes to the client care management. If we say knowledge management system, it is related to the knowledge management, wherein this information will utilize the platform such as the information technology system, so that this will be in a perspective on how this information will be stored, will be retrieved, will be distributed as according to the need of the healthcare facilities and manpower. So again, the difference between the knowledge management, it is the process wherein the knowledge can be distributed, the knowledge can be captured accordingly, which is based from the intention of the healthcare facility and for purposes of clinical management by the healthcare workforce. While if this knowledge management will be integrated into a platform, into the IT system, this is on how this information can be retrieved and can be used for information exchange among these facilities. When it comes to the information technology, this is more on the use of the computers and the telecommunications, wherein this will entail on how the information can be stored, can be retrieved, and can be sent through information. This is the what we call the IT system. So if we will try to connect it with the knowledge management and knowledge management system, the knowledge management is considered already the information that are readily available for distribution. While the knowledge management system, the information that can be stored through the IT system for purposes of exchange of information. And what is that IT system? The information technology, which will be used eventually for effective storage and retrieval and even sending of information. So if we say information technology, these are servers, the internet, the network, the application, the software, the security features, the database, and the hardware. These are all the components of the information technology. And if we will consider now information technology as information technology system, it is now on how the use of this servers, internet network, support system, application, and database can be now integrated as part of services. Services which will consider for the operations of the hospital a wide range of services that can be extended, and its availability when it comes to the use of the information technology. So we have the four terms that we have considered. We have knowledge management. These are the information that can be retrieved and can be captured as a knowledge and information. The knowledge management system is the use of the IT system. Okay, the use of the IT system to process the information exchange. The information technology itself are those that can be used of the systems for storage, retrieval, and sending of information. And if we will consider information technology system, this will have a wide range of services to support the operations of a certain healthcare facility. So that's why if we use the knowledge management system, there are terms that can be associated with it. And we could have knowledge management as an insight because, for example, in client care management, insights coming from the healthcare team members can be useful as an exchange of information for the holistic approach of the client. A nurse can have exchange information with the nutritionist for a diet care plan. A nurse can uh, can coordinate eventually through the use of the knowledge management system to the radiologist on the on the results of the radiographic examination done to the client with the specific impression. So these insights can be shared accordingly professionally based from the perspective of the competencies and based from the perspective of evidences. And that's why the basic knowledge management that we considered are information. That's why when we discussed initially about the uh, information technology and health informatics, nursing informatics, data, information, knowledge, practice, utilization. So the information, if this could be useful and these are meaningful and these are used already by nurses when it comes to client care management, this is already knowledge management because information can be accessed, information can be used for validation, and information can be used for clinical decision making so that it turned out into evidence-based practice. So that is knowledge management. So that's why after this translation of how the nurse can utilize this for clinical decision making, the application of it to the actual practice and direct client care management is part of the practice. So that is the translation from information to the practice already. And this in between is considered as knowledge. And knowledge management can use the what we call technology. So that's why we have mentioned about information technology. This could be a network that can store, that can retrieve information anytime as necessary. And insights, information, practice, and technology cannot be processed without the people, the manpower. The manpower, they are the ones who are competent to process the knowledge, which will be useful for the operations of the facility and at the same time for individual care management. Knowledge management can be used also for improvement because the knowledge and information continuously evolve even in 24 hours. So this information can be used for enhancement, enrichment, and improvement on how the institution can perceive this as a positive uh, information that may translate into improvement. So it will always take into consideration that knowledge management considers the what we call nursing science, information science, and computer science, as I have oriented you when it comes to the nursing informatics. It will take it will still be considered as a process because the readily available information will be translated into the knowledge, practice, and utilization. It will still need steps on how it will be processed. So that's why process as a scientific basis and reference when it comes to knowledge management. So even with the advice, so advices are always based from standards and are always based from the literatures. And these references could be used as knowledge management. So that's my a question comes in that why knowledge management is an important pillar of a digital workplace. If we say digital workplace, we're already using the knowledge management system and the information technology system. Digital workplace used already hospital information system, already use primary healthcare applications, the mHealth, the eHealth. So these are part of why knowledge management is significant when it comes to the digital workplace. And indeed, the four reasons why knowledge management is important in the digital workplace is first and primarily, it will increase customer service and support. Actually, the outcome that is expected when it comes to a more digitalized workplace is customer satisfaction. And every customer satisfaction will extend to measurement of quality services provided by the healthcare workforce or even with the institution. When we talk about boost productivity, once employees, healthcare personnel, non-healthcare personnel may boost productivity if the workplace have an enhanced system that will that has a significant relationship when it comes to the pacing, and that is time. So it may not be necessarily to, and it doesn't mean that it will replace interactions. It's still very important. However, the access to the information is very relevant for a very timely and prompt response to situations of urgencies. So that's why it may boost productivity because eventually the timely response itself can also connected to the increased customer service and support. So that's why, on the other hand, with this boosting of productivity and at the same time increasing support and satisfaction of the stakeholders or customers, it will facilitate the employees for continuous learning. The curiosity itself on how it will work. At the start, there could be resistance. They could be reactive in some ways because of these transitions. But the importance of leadership and governance of the administration is very helpful on how it will lead to realization. Thus, may boost productivity and at the same time may facilitate continuous learning. And eventually, they will be considered as your arm based from the evaluation of the system on how it will continuously be improved. And that's continuous learning. So other than that, it include here as one of the importance of having a digitalized workplace is to reduce duplicated knowledge. What do we mean by duplicated knowledge? Since we're talking about knowledge management system and we gear towards the implementation of standards, this will facilitate on how it will unify the perspective that if there are cases of clients that are being identified and admitted in the hospital, there could be a similar approach on the same cases, but still we considered individualized approach. So the duplication of the knowledge could be adopted, but not merely the total duplication is merely implemented, because seemingly we still take into consideration continuous assessment and individualized care approach. So these are the importance of having knowledge management or using knowledge management in a digitalized workplace. Now, When it comes to the information management system and the knowledge management system, we have talked about that in a digitalized workplace, if the institution may need the information and information is not yet available, it is considered as data. So that's why the use of the information management system may convert the data into the information. Because I have mentioned to you about interoperability standards wherein there are already exchange of information, and once the client or the stakeholder already fill out a digital form or an e-form, that is already supplementing information from the data needed. So the conversion itself is merely on the information management system. And once this information is already used by the healthcare team, when it comes to diagnostic, subjecting the client for diagnostic examination, subjecting the client for validation of previous hospitalization and medical history, this becomes already a knowledge because they are directing already on the process on how they will use this information on an individualized care that could be given to the client. So that's why even here in the Philippines, we have the executive order number 119. If you say executive order, these are usually from the level of the office of the president. That the executive order number 119, the entitled reorganizing the Ministry of Health before it becomes Department of Health, it's Ministry of Health. It's attached agencies for other purpose. The Reorganization Act as issued by the former President Corazon C. Aquino last January 30, 1987, already mandate the direction on how to have knowledge management information technology service or the KMITS, which evolved in the succeeding years. However, the executive order number 119 uh, uh, has given a direction on how attached agencies is very useful so that to attain the vision of the Department of Health, which is before Ministry of Health. So that's why under the executive order, it already created under the office of management service, the management advisory service. Because during the time, it already started on how to manage efficiency, and the efficiency that we have talked about is the maximization of the available resources. And the management advisory service or MAS is mandated to basically provide assistance to provide staff advice and assistance so that it will improve the internal control and management system. So that's why they have started primarily in their own in the Ministry of Health to process the improvement of the management system before it evolved on how this could be applicable in an external perspective. So that's why even the ICT as the vision of the knowledge management and information technology is gearing towards the implementation or supporting the universal healthcare. It always consider improving healthcare access because once a client could be satisfied with the healthcare services that he or she may need, and she was attended to it, so it's already a healthcare access. It provides high level of the independence. So with the quality, this will entail, other than with the high level of independence, the clients can already attended to their own and share this also to the other family members. So these are extended outcomes, and this provide the quality. So as we have mentioned, that efficiency is the use of the available resources, and these available resources are the ones being used during the time that this may be translated into a more a more and a high level of technology, since during the time it already evolved the emphasis of a priority agenda in information technology. However, even with this technology, that has been introduced, it will always a high priority to consider patient safety and satisfaction. So that's why it evolved already under vision to have allocation of resources. So that's why at the time that I have discussed to you the vision 2020 and the areas that had been covered pertaining to this vision, it started on how it will consider universal healthcare, wherein the mission itself is to effectively use the ICT. A while ago, the vision is all about certain areas that will benefit the community and the people on a national level, while the mission is what is in existence during that time on the resources can effectively manage. If we say effectively manage, the measure itself that that the presentation and introduction of this and communications technology have already considered indicators on how it improve healthcare delivery system, just like for example, the one of the outcomes is uh, the access for the immunization rate. Then it increases the immunization rate after a certain period that the 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 health center personnel access the information about the status of the immunization rate. So this is already part of the mission. So when it comes to the channels of administration and management that will cascade the information to specific administrative decision. So before, we have already in existence of email, but with the use of the platform, it will already consider the 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 perspective that this could be more effective in such a way that we attended to the client's needs. So what are the general functions of the knowledge management and information technology system, or KMITS, of the Department of Health? When it comes to the national level, it is very important to have plans, policies, and programs, and even standards so that it will unify the use of the information system and the information technology. Uh, if we have already the information technology available, it will still anchor the need for funding. It will still anchor the need of staff development on their competencies. It will still need to consider the resources if they have uh, stable internet connectivity. So these are ways on how the KMITS, the DOH KMITS, facilitate specifically the roadmap or annual plans when it comes to the specific strategies. The second is pertaining to develops and manages the management information systems for the Department of Health. So since this is an attached agency of the Department of Health, it always consider the management information system. So just like now, we do have the KMITS in place, there must be also a benchmarking on how the ASEAN nations are using this management information system at their level, since the common socioeconomic status of the countries in the Southeast Asia may benchmark best practices and be applied in our country. So these are one of the functions of the KMITS. Next is when it comes to the information technology structure, infrastructures and services. If you say infrastructures, or the available resources, and how this will translate into the services and may reach the people. So these are the KMIT's general function. However, this health information resources may also use to archive. Just like when you visit the Department of Health, most of the memoranda, most of the related information on a certain advocacy or DOH program are arranged into archiving. So that's why the tracking and the archiving services are very important, because this is relevant for analytics. And that's why even the human health resource development or management, or the HHRDB, are also benefiting on this system. So that's why we have the undersecretary, or the director rather, who is in charge of the official and standardized advices coming from the KMITS, which is relevant to the universal healthcare. Just like what happened before, the tracking system are basic functions of the knowledge management information technology service for the effective contact tracing. Another is for the effective uh, cascading of information and consolidation of information about the cases of recovery, active infections, and at the same time deaths. These are very important matters that will prepare our community people when it comes to prevention, and this could be also the basis of the IATF when it comes to the any promulgations of guidelines. So as of now, we have the Director 4, Dr. Enrique A. Tayag, as the Director 4 of the Health Facilities and Infrastructure Development Team of the KMITS, of the DOH KMITS. So let us now proceed to the discussion of the structure of how the Department of Health KMITS exists in the country. So the Knowledge Management and Information Service has three major divisions. So the three major divisions are more on the systems and software engineering division. So this may pertain on their tasks, specifically on how a specific management information system is feasible in a specific area. Another division is the Information Technology and Infrastructure Security Division. So when it comes to the functionality of a certain application or platform and security features in compliance with the Data Privacy Act, this is more on this division. And the Knowledge Management Division are more on the content, so that it will satisfy the needs of our healthcare facilities and the healthcare team. So that's why when we talk about the formulation of plans, policies, programs, and standards, for what aspects? So systems and process improvement. So even if you witness on how you attended in the how you have been attended into the vaccination site, uh, it's still a combination of the traditional and the use of the technology. However, sooner or later, the appointments could be standardized, and the process will be improved use of the technology. Although there are some areas, even in the National Capital Region, is you need to register already in their portal, and the QR code will be released or will be issued once you have completed the process, and that is the one that you will show to the vaccination site, so that for validation. So that entails also the number two, the systems and software development. It is a continuous process and evolution on how we will improve the system and may satisfy the needs of the people in the community, and at the same time the access of the healthcare management team. So part of it is the number three, establishment and maintenance of information, how the information will be stored, how it will be retrieved. These are part of the guidelines that we must have to consider. The number four is communication technology, or the ICT solutions. If we say ICT solutions, these are specific measures to secure this information. So that's why the use of the barcode, the QR code, the acceptable passwords are very important guidelines for us to make our people knowledgeable and aware on how this could be possible when you use the platforms introduced by the Knowledge Management and Information Technology Service. So let us now proceed to its subdivision. The subdivision of the systems and software engineering division is more on the use of the research findings. Yan. Research findings that could evolve into database design, systems analysis, design integration, because it's a continuous process of improvement and enhancement. Kaya if we say enhancement, we could add feature or either there could be recommendations that it could be more efficient and effective if we will integrate this additional systems improvement. So it's more on the engineering. Kaya pag if we talk about engineering, these are more on the details eh. And at the same time, this is more on the design. Design na there could be versions. Kaya that's why even ang mga applications, may mga version yan, version 1, version 2, version 3, version 4, because it's a continuous process of enhancement and improvement. Before, a mobile phone just only have a manual text keypad, but now we have the touch screen. Another is we have, before we do use a camera which is separate from the mobile phone. Now it's already integrated in the mobile phone. Now, on this perspective, other than with the design, this will operate on the national health information. So that's why most of the plans could be cascaded by the KMITS to the national, which is the Department of Health, and may include this for funding. So they are the ones who really have this picture that this will benefit the public and the healthcare system. Another is for the Information Technology and Infrastructure Security Division, their purpose is more on the operation. Planning is more on the engineering division. The Infrastructure Security Division is more on the operation, on how it's being used, how this could be operated for 24 hours. So upgrading itself when it comes to the access and the security are more on the Information Technology and Infrastructure Security Division. How about for the Knowledge Management Division? For the Knowledge Management Division, this is on how it will facilitate technically exchange of information on how it will benefit healthcare team management, how it will benefit a certain department, so how it will be consolidated and put up into a data, information, and knowledge and utilized in the practice. So nandyan, it's more on the Knowledge Management Division. So let us now have a different, let's now distinguish the difference. So systems and software engineering division is merely more on the plans, designs, software. For information technology infrastructure, it is more on the operations, security, and knowledge management system is on how it will facilitate exchange of information. So I think those are the topics that are within the presentation of how the Department of Health Knowledge Management System or Information Technology Service and its importance. Why do we have the KMITS in the Department of Health? So thank you very much and good day.